First, I would like to start off by defining what alcoholism actually is. According to the CDC website, excessive alcohol ingestion or excessive drinking comes in two different forms to be considered a concern. We see one concern being binge drinking, which can be defined as 5 or more drinks at one time for men or 4 or more drinks at one time for women. The second would be heavy drinking, which is defined as 15 plus drinks per week for men and 8 or more drinks per week for women. The CDC states that risk of abusive drinking habits can include physical health problems such as disease, organ failure, compromised immune system, unintentional injuries, mental health problems due to the use of alcohol being classified as a depressant, or compromised relational or communication problems. According to the National Institute on Alcohol Abuse and Alcoholism, or in other words, NIAAA, 25.8% of individuals 18 years old and older have participated in binge drinking. This statistic comes from a study taken in 2019. According to the U.S. National Library of Medicine, National Institute of Health, on the other side of this page. Here I have included a table that shows statistics comparing U.S. citizen drinking habits before the coronavirus pandemic shutdown and then during or after the shutdown due to the pandemic. It may be hard to see looking at the table from this presentation, but here we see drinking habits have increased 60.1% compared to pre-COVID-19 due to the increased stress being almost 50%, increased alcohol availability being about 35%, boredom being about 30%, and other reasons being at about 6%. Alcohol dependency is extremely common in today's society, and especially in American society, and with that, we see this as an extreme family stressor under the realm of family communication. So, this is where we need to ask the questions considering different circumstances and relational factors that can affect family communication habits. Who is being affected? How does a family cope during this type of stress? What are some developmental changes and stages of this type of stressor within a family unit? So let's start off with who is being affected. Considering a family unit, it is important to acknowledge every person that can be possibly affected by a stressor. So, who is being affected? The answer is everyone. In our course textbook, Galvin states stress varies with the person and age of each family member. In other words, each person in the family will react differently to any family stressor. With that being said, we can easily say that children will react differently with a parent being the victim of an alcohol dependence based on their age. How would we see parent or guardian figures react differently to their child's display of alcohol abuse? And how would we see this play out through interactions with extended family, blended families, and others? Considering these different circumstances, it is important to understand the different types of family stressors that a family can experience. So, here I would like to talk about ways to communicate through issues related to alcohol abuse within a family unit. According to Galvin, we read about the different types of stressors and alcoholism being a vertical stressor. Vertical stressors are defined as stress factors that affect the individual and causing issues in different family systems. And here we see this through the family stress model shown by Galvin. The family stress model displays how a family goes through a stressor and the different stages in which a family adapts. The stressor event in this scenario is the alcoholism within the family unit, and the family must find resources and coping mechanisms on how to deal with the stressor. It is always important to incorporate family strengths and ties into how an individual experiences the specific stressor. Here, I would like to talk about coping. The central mechanism through which family stressors, demands, and strains are eliminated, managed, or adapted to is the definition of coping given by Galvin. According to the article Alcoholism as a Developing Family Crisis, there is a system theory that discusses the idea of homeostasis in family roles. The goal is to minimize disruption within the family as well as set roles within the family, and this is where Galvin's idea of resilience comes into play. To continue, our textbook defines resilience as the ability for family to function while in the middle of adversity. Dealing with adversity in this context, family members must take care of themselves during times of distress along with the event causing the stress. In this case, family members may want to seek out programs such as Alcoholics Anonymous, rehabilitation centers, support groups, mentors, or support programs for children, family therapy, and as well as the support of each other. According to the American Academy of Child and Adolescent Psychiatry, children being raised by a parent or guardian with alcohol dependency can display a variety of conflicting emotions in the child, such as guilt, anxiety, embarrassment, and so on. Research shows that children who have support from family as well as availability to outreach centers or programs are able to cope more easily. Here are a few organizations on the other side of this slide that are known to help children in their times of family distress, including the American Academy of Child and Adolescent Psychiatry Campaign for American Kids, the Boys and Girls Club of America, and the National Children's Campaign. To wrap things up, I want to include a small discussion that can be talked about amongst the class. Here is a scenario. John and Maria have been married for 15 years and have a 12-year-old daughter named Em. Em is just starting middle school and is going through a big adjustment moving into the adolescent stage in her life. Em begins to notice that her dad is drinking beer a lot more often than he used to. At this point, it has gotten where John cannot go one day without having multiple drinks, and it is starting to affect his ability to go to work. Emma has yet to say anything about the noticing of her father's behaviors to her mom, Maria. Putting yourself in Emma's shoes, discuss how you would communicate this stressor and these concerns to Maria. Here are some things to consider during your discussion. Outside stressors, communication or relationships between parent and child, or relationships between partners. Thank you.